Hi everyone, this is Vicky from NP Reasoning, and today I'm going to talk to you about diagnostic frameworks. So, essentially, how to apply diagnostic frameworks to any clinical case that comes in front of you. There is no need to wing presentations when we see patients. We should essentially always be using some form of diagnostic framework to guide us through that presentation. So, again, we're going to learn how to create these diagnostic frameworks for common presentations. It's important to highlight that it's not a one size fits all. So, I'm going to present what types of frameworks you can use. And it's really about you experimenting and figuring out what frameworks work well for you given the current presentation in front of you. So, let's get into it. So, really, how do we create differential diagnoses, right? We're not winging it, we're not pulling things out of thin air. We use our knowledge base about disease and we create these diagnostic frameworks for various clinical presentations. So, the four common frameworks used in medicine are the systems framework, the mechanisms framework, the anatomic framework, and the checklist mnemonic framework. Again, really important to highlight that it's not a one size fits all. It's really up to you to figure out what framework works best in your brain to organize a case in front of you. And I'll go through many case examples of what I mean by this. Next, we're going to dive into the anatomic framework. I would say, anatomic framework definitely works well for various pain presentations. That's a common one to utilize for that. So, to exemplify that, let's see, classic case of a young male with right lower quadrant pain. So, off the bat, you might be thinking, oh, appendicitis. But again, if we wing it, we're going to miss some crucial, possibly red flag diagnoses, right? So, what you ask yourself is what anatomic structures in that area can cause right lower quadrant pain. So, I like to think of the GI structures, right? For sure. Could it be the appendix, the colon? It could be diverticulitis, inflammatory bowel disease, IBS. And kidney structure, could it be kidney stones, pyelonephritis, so that region? And then lastly, genitourinary structures. Could it be a bladder infection? Could it be a testicular torsion, epididymitis, orchitis, etc.? So again, if I were to kind of wing it, I might actually maybe not think of testicular torsion if I'm kind of honing in on, oh, it's the appendix in the right lower quadrant. So again, having a framework helps tailor what you're now going to assess on your history and physical exam. Another example is, patient presenting with chest pain. So you could certainly use different frameworks for this, the systems framework, but you can also use the anatomic framework, asking yourself what cardiac structures can cause chest pain. So of course, we think of the heart, the cardiac area, right? Could it be acute coronary syndrome, valvular disease, pericarditis, aortic dissection, respiratory structures? So could it be a lung pathology, right? In the bronchus, lower in the lungs, like a pneumonia? Could it be a musculoskeletal anatomic area, right? Chest wall pain, costochondritis, gastrointestinal could include the esophagus, the stomach, and the other bucket. So as you can see, just helping tailor your differential before you even see that patient.